Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And today I would like to welcome Ava Safir and Madhavi Parikh. Thanks for joining us today, Ava and Madhavi.
Happy to be here.
Thank you for having me.
You're
Happy to be
very
here.
you're very welcome. And by way of introduction, Madhavi Parikh is a PA and cancer coach currently working at a cancer center in integrative oncology. And Ava Safir is a registered dietitian local to me. And Ava and I recently collaborated on a 𝗂𝗵𝗃 article and podcast speaking to why patients need a registered dietitian on their healthcare team. And today we'll be talking about how the work that each of you are doing supports patients and doctors. And what would you most like our audience to know about you as we begin our conversation? Feel free to include hobbies, whatever you wish. Matvi, would you like to go first?
Sure. I was hoping it would be Ava.
Oh,
No worries. It's all good. So, as you mentioned, Kim, again, thank you for having me on this podcast. It's an honor. I am a PA, and there were two things I knew growing up, or maybe three. One, I was going to come to America. I would practice medicine, and I would practice meditation. And after having come here, I have been very fortunate to have found both, especially the PA profession, because it allowed me to practice medicine without having to go through the time, energy, and rigor of med school, for which I'm very appreciative that the doctors have that expertise. Um, and I have always practiced in the field of oncology, medical oncology, except for a few years in chronic pain. And over the years, with the combination of my meditation practice and having good mentors who taught me the importance of looking at the person as a whole and learning from my patients together, I have been able to now get into the field of integrative oncology, which I love because it helps me to take the whole person into account: mind, body, spirit, family, community, environment, everything that sort of makes up who they are. And then that also allowed me to bring it to myself to understand that whoever, whatever I am, is also a product of all of that. And if I don't take care of myself, then it's very hard for me to take care of other people. So I was to learn from how doctors work, from how the whole entire team works, because I can't do it alone. No one can do it alone. The patient can't do it alone, neither can the providers, whoever the providers are. So putting it all together is kind of my approach to practicing medicine.
I love that and the things that you said about looking at the patient as a whole, and that's one reason that I have you on together as well. I know Ava does the same thing, and also that we aren't meant to do this alone, and for doctors and all the other healthcare workers to know that you can support each other, and that's why I love these collaborations to spotlight that. So thank you, Matvi and Ava. What would you like us to know about you?
So I think my is a little different. Becoming a dietitian was a career change for me. I was a history and philosophy major and then an attorney, so very different than healthcare. But then I had some personal health issues that I had to navigate, and honestly, I had some frustrations with the healthcare system. I often didn't feel heard or listened to, or I felt like certain assumptions were made about me at the time until I found a wonderful provider, an integrative physician, who really listened, who really took the time to work with me and really revolutionized my health in so many different ways. And so I was inspired to go back and to get my degree because she did use nutrition in a lot of the care that she provided to me. And again, that same concept of full body. We talked about movement and stress and sleep and our families and all that kind of thing. So I did go back and get my RD. And I did it with an eye towards wanting to work with people to help them achieve the wonderful health benefits that I had achieved as well. So now I started a private practice with actually a former preceptor, someone who had precepted me during my internship. We decided for some reason that 2020 was a good time to start a practice. And so we did. And so 5 years in, I just love working with people. I love seeing those moments with people's it just clicks, something just clicks in them. And it really does make a wonderful difference in their lives. And I guess something else to know about me is I'm a little bookish, I'm a little introverted, so I'm not one to be out there with a big platform. So, but I do find so much joy in those micro moments with people. That's really where my passion lies at this point.
Well, thank you for sharing, and that is quite a career transition, right? You went all that work to be a lawyer and then continued on to be a dietitian. That's not, a typical transition,
No,
but
no,
it's exciting and it's what was right for you.
exactly, exactly. So.
That's terrific. Go ahead.
No, I was gonna say, I guess it allows me to sometimes understand certain rules and regulations in certain ways
Hmm.
that maybe some others don't. But yeah, this is definitely a much better fit for my personality.
Yeah, well, that's terrific. And I will share that we know each other because I was having some elevated lab numbers and I didn't want to go on an additional medication. So my primary care doctor referred me to you. And, you provided me with some helpful information, which is why we went on to write our 𝗂𝗵𝗃𝗃 article and record the podcast, and also why I wanted to have you on here today. So thank you for all that you're doing for patients.
Of course.
And I like people to share a powerful story because people remember the stories most of all. So, Matvi, what would you like to share with us today?
Is it patient related or just any
Well,
story?
how about related to why you're on Stand Up for Doctors?
Ah, so in 2023, I was practicing integrative oncology from 2019 onward. But in 2023, I lost my job and I had to make a transition into deciding what is it that I wanted to do. And for me, like I've mentioned, medicine is everything. I really know cancer quite well, even its temperament and its personality sometimes. And I had seen good results when I spoke to patients uh, from an integrative perspective, asking them to tell me their story. And through that, I was understanding where they're coming from, what is it that they want, what is it that's holding them back, and also giving them a realistic perspective into the state of their disease process. Because understanding with awareness and then acceptance is a big part of the healing process. It's not about, we may or may not get a cure from whatever it is that we are suffering. But if we can find that place of healing, then, and that healing comes from a place of acceptance, then that would be the way to kind of move forward. And I was seeing good results with that, regardless of the outcome, because sadly, in oncology, especially, we don't always get the radical remission that everyone is looking for. But then, how do you get people to understand what life is about? How can they live right now? And how can they make the decisions more from a place of education and empowerment versus just kind of saying, I hate the conventional system, I hate pharma, I hate everything about the medical system, and I'm going to do alternative medicine, which is also, and the truth is somewhere in between, which is the complementary medicine part of it. And it can have a little bit of way out there kind of medicine, but it can also, on the conventional side, have way out there as well, right? So how do we bring people into the middle and in a way that works for them so that that increases compliance? And but for that you have to listen to the person and you have to know what their resources are. Right. So that is where in 2023, when I lost my job, I had to become an entrepreneur for a couple of years by necessity because I wanted to continue my practice of this coaching way of non-medicinal, non-prescriptive way of practicing medicine, having the patients utilize the resources that they have on hand.
Mhm.
And so slowly through that, I started learning as well. Learning never ends. Once it begins, it never ends. So I was constantly learning, but I also, through that, found that it kind of reinforced my way of working with patients. And I feel like that has also helped me arrive to a point where I am content and able to share that with my patients. And what I like seeing is every time I speak with a patient, they go out smiling. They say, "You give me a little bit of hope and understanding." And that's all I want because I can't cure anything. The
Right.
work is yours to do. We can guide you, we can mentor you, we can give you the resources, but the work is for each one of us, it's our own to do. So how do we arrive to that place is how I work.
That's so true. And I love the East meets West philosophy. And also when you talked about, just like I asked you to share a story when patients share their stories, and that's what's lost today is time. The doctors don't have time to necessarily hear those stories. And that's one reason we have to change things in the healthcare system and get back to that because you learn so much by hearing the patient's story. So, and that's why the work that you two are valuable because sometimes you're afforded more time to hear these stories than, unfortunately doctors are, even though they wish that they had the time. So, Ava, what would you like to share with us? Tell us a powerful story.
Yeah, I mean, I think I would agree with Madhavi about really listening to the client or the patient. Oftentimes, people joke about dietitians being the diet police, or they'll be nervous to tell me they ate a cookie or a potato chip or something. And in all honesty, that's not something we really we care about, right? We definitely want honesty in the relationship, but really what's really transformative, where people really make a change in their health, is when we get to the underneath. It's
Mhm.
not about the cookie or really what people are eating, frankly. There's usually some other situation going on underneath that, the food, right? For some people, we'll end up going all the way back to their families of origin. Other people have various other stressors going on in their current lives. Sometimes it's a busy mom, sometimes it's people working very long hours. People have, images of themselves based on their own family. Well, everybody in my family had diabetes, so I'm going to have diabetes. There are roadblocks in there for folks. So, what I love doing with my clients more than anything is really digging in, listening first, always, trying to understand what is going on in their lives. What are some phrases that keep coming up in our sessions that I'm able to then sort of grab those strings and then reflect back to them over time to kind of see where is the sticking point here. And then we kind of work through a little motivational interviewing, and try to, work through those sticking points. And then the behavior change itself becomes so easy.
Mhm.
Right? Once you kind of get over the roadblock, the behavior change itself just sort of comes more naturally, and people aren't struggling anymore. So, and like you mentioned, we have so much more time than doctors do. We spend at least an hour with every client, every session. And I think that's one of the things I'd love for doctors to understand about us as outpatient dietitians, that use us as a resource. They're often telling us all kinds of things they did over the weekend, things that are going on in their lives, things that are coming up, right? A pet passing, all kinds of things are coming up in our conversations that go to, what is going on with their health. And the doctor only gets you for 15 minutes. They have to get through things very, very quickly. So a lot of times I'll pick up the phone or I'll write a letter or something and just say, hey, I just wanted you to know this is something that's going on, or here's something that seems a little strange to me. What do you think? And then we can kind of give the client or the patient sort of more holistic healthcare, right? We have multiple avenues coming in, and then the patient really gets the best care possible. So I think that's something I guess I wish more health care professionals, doctors in particular, understood that about us as dietitians. And that we need them too. Sometimes we're trying to figure things out. It's like, well, what's going on here? And I don't have the medical background,
Mhm.
right? They have it. So I would love to be able to bounce more of that off of more doctors, to get a better understanding, so we can really have the best outcomes for our clients.
Hmm.
Yeah.
Yeah, I love that, and that you have the time to do that. Like you said, listening. I've done an episode on that includes motivational interviewing. All of that is so important, and also for patients, sometimes, like in my case, like I didn't know what I didn't know. As far as I remember, I was very intentional about my protein intake, but I didn't realize I was using outdated guidelines. So that just you having the education, and knowledge to share these things is really invaluable. And Matvi, I was wondering if you had any tips for us, since we're talking about kind of like cancer, like oncology meets nutrition. Do you have any specific like information or tips on how nutrition can impact, cancer patients?
So it depends. Yes, nutrition is one of the main things, right? Like the way my approach to looking at the patient is the four quadrants of the body, which Elizabeth Kubler-Ross gave in one of her talks. And it's like the spiritual, the physical, intellectual, and emotional. And she mentioned that it's when we are out of balance in one or the other, that's when illness is present, right? So how are we working on that balance to come back to health is something that really spoke to me, and it makes so much sense. And in the field of oncology, the physical is a big part, especially when someone is going through treatment, and then to prevent the risk of recurrence as well. But at the same time, we can't be so rigid, as Ava had referred to as well, that you can't, like, it doesn't make sense to you because there are so many factors that make up a person's nutrition and diet. And who knows what is holding them back. So I try to understand from their perspective, what is it about nutrition or whatever it is, any process, what is it that's holding them back? But there are, like also Eva referred to, alluded to, that sometimes people don't have the money to buy all these organic things. Then they need a little bit of assurance that it's okay to not eat organic as long as you're eating fresh, right? And then maybe just look at the anti-inflammatory diet or look at the Mediterranean diet and make the changes that you can. And one day at a time, one meal at a time, one step at a time. And then I refer them to a nutritionist, to a dietitian, to talk to them, to kind of help them and also get the resources that might be beneficial that only they know, which I would not know, right? So I pull them in and kind of talk to them about, make sure you follow up with them.
Mhm.
So because that's half the battle, right? Like the compliance, so overwhelmed with so many appointments, all of, like, just so many burdens on them that they can't keep up. So how do you break it down? Nutrition breaks it down. You help them break down their medicines. You help them break down the way they behave, the way they think, kind of get into it. And that's the approach I take, whether it is with any part of their treatment, of their medical life,
Hmm. Yeah,
which
that
kind of bleeds into their personal lives.
Yeah, right, right. That's great. So, Ava, I know that cancer treatment and nutrition isn't your specialty. I was wondering if you ever do get referrals, because I know, like my friend, when she was going through chemo, almost anything made her nauseous except like banana bread. So, she was eating a lot of banana bread. And I remember when my dad had cancer, and well, I just try to say, well, just eat the protein, like make sure you get enough protein. But none of that tasted good for him. So I was wondering if doctors ever think to refer patients to you when they're going through cancer treatment.
I don't actually get a lot of referrals for cancer treatment, interestingly. My sense is a lot of inpatient dietitians probably talk to people, but that maybe once they step outside, I'm not sure how much support they're getting. I do have a colleague locally who focuses on this specifically, cancer nutrition. So the couple of times I have gotten referrals, or if I think it's just maybe somebody who's in recovery, but I think it would be a good idea for them to have sort of I don't know what the word would be, just sort of a instruction or sort of a repeat of the instruction. I definitely send them to her because that's all she does, right? So she knows the ins and outs, she knows the little tips and tricks. Um, so she would be a better fit.
So if I may add, like if someone is having a lot of nausea, then coming from my background as a PA, I'm asking, are they taking their antiemetics properly or not? Do they have a lot of acid reflux? Because that can cause nausea. If they have the taste changes, I offer from a more integrative, holistic perspective, certain options like oil pulling and so baking soda and salt gargles, making sure that they do that and putting emphasis on that so that they get the benefit of it, right? Like because oil pulling is swishing coconut oil in your mouth for about 10 to 15 minutes. And who has the time to do that?
Hmm.
And that if you do spend the time to do that, then you're going to get good outcomes from it. So I'm trying to find that out. And then how is it affecting their nutrition intake? And if it's banana bread, that the only thing that they can eat, trying to help them kind of integrate other things slowly
Hmm.
and eat the banana bread and then eat something more nutritious so that you get the nutrition that you need.
Or putting, I don't know if this is appropriate, but trying to have a recipe where you can put a little protein powder and nuts in the banana bread. Right?
Correct,
That
exactly. Yes, or make it smoothies, for example, do a lot of smoothies so that you're getting the hydration. Correct me if I'm wrong, but at least you're getting the hydration and some fiber with it so that you can then go to the next step.
Yeah, and Kim, I would say this is it's similar to the folks who are coming in on the GLP-1s.
Yeah.
Many, the nausea, the GI discomfort, the food aversions, we're seeing a lot of that as well. So I would say a lot of the suggestions Madhavi just made are exactly the types of things we talk to our clients about on those GLP-1s. Which, by the way, I'm just going to put a little buzz out there. Please, doctors, have your patients go to dietitians when you put them on these medications, because
Yes.
we're really just seeing people not do it correctly, and we want them to be healthy. And if you're going to go through all that expense and all that difficulty on one of these medications, do it the right way.
Right. Well, I think this is really all great information, for doctors to consider because so many patients have cancer. I mean, I've had cancer a few times myself, and to know that there's other people like on the team that can help, and to refer patients right to a dietitian or that there's an integrative oncology that can help. I think this is fantastic, and also, like you said, with the new GLP, whatever those things because that's really big now. So to know that there is support out there because the patients will be happier, because they'll be able to speak with other healthcare professionals that have the time to, really talk to them and answer all their questions. So it's like a win-win-win.
Hmm.
Yeah, yeah, and
Yeah.
I'll say too, like even recently, I had two newly diagnosed diabetes patients where no one had yet talked to them about wearing a CGM or doing their blood sugar testing. So it was like providing that sort of education and then reaching out to the doctor. I think these two folks slipped through the cracks. One doctor was transitioning out of the practice, a new doctor was coming in, and they fell through the cracks, right? So because we got to spend so much time with them, I was able to reach out and say, hey, here are your two patients. These two people really need some support in the blood sugar regulation realm. Obviously I can help with the diet side and the movement and all those things, but they really need to be checking their blood sugar. So working together hand in hand, I think really is the best way you can have healthcare.
Absolutely.
Yeah.
Yeah.
Unite in the fragmentation that is present in the healthcare.
Yes. Yes. It's very siloed, I would say right now.
Correct.
And that's what I'm trying to do with all of these conversations, right? When I have doctors of different specialties on, talking to each other, when I have a doctor on with another healthcare professional, or when I have other healthcare professionals on, that we're showing how, we all are connected, we all can be connected and just support each other. So yeah, Matvi, I've heard of oil pulling and I've tried it a little, and I don't remember specifically why I tried it, but you're right, because if you're supposed to do it for 10, 15 minutes, then you just kind of give up. I never got to that 21 days. So some people might not have heard of it. And like I said, I don't even remember what the benefits are if you'd like to share that.
Well, the benefit is oral hygiene. So whether you have cancer, whether you're taking treatment or not, it doesn't matter. I can't explain the entire mechanics behind it, but it's basically the coconut oil, the fat, or people even use sesame oil. But I've been told by acupuncturists that sesame oil is for certain temperaments or certain body types. So it's not across the board for everyone. And coconut oil is more neutral and it's available everywhere. So basically, you're taking a small mouthful and you're kind of swishing it around in your mouth. And it's that fat that goes through the mucous membranes and is helping pull out the toxins. And it also helps in healing. So there are so many chemotherapeutic medications and drugs that give mouth sores and ulcers and taste changes and smell, and the smell connected to the taste changes as well. So in order to reduce those aversions that we may have as well, that mouth pulling is just something that if you start with 5 minutes, but
Uh-huh.
the longer you do it initially, the better it is. So inside the mouth, then the fat changes textures and then eventually you spit it out. And then the longer you do it, you will see that the texture doesn't change as much because your mouth has healed. The coconut oil doesn't have to do all that work. So it's like, but if you start doing it 2 or 3 times a day upon awakening, before bedtimes, 1 or 2 times in between, it's really, really a very easy but super effective way of taking care of oral hygiene.
Okay, well, thank you for reminding me of that. And so the place you're working now, tell us a bit about that with their integrative oncology.
Sure. I'm working at 𝗏𝗏 Cancer Center in Seattle. And in the integrative medicine, they don't call it integrative oncology. It's integrative medicine in oncology. So I'm in that department, and many cancer centers are. So there is, with cancer bringing mortality in front of our faces, there is a huge patient population that is doing their own thing. They're looking for ways to reduce that mortality right now that's in front of them. So they are doing a lot of different things, be it through vitamins and supplements, through nutrition, keto, fasting, all of those kind of things, be it super exercising so much way out there kind of thing. Energy medicine, they're doing a lot of different things. But the conventional side, unfortunately, is not on board with whatever the patients are doing. So only 30% of oncologists kind of know and approve maybe some of the modalities that the patients are doing, but more than 70% of the patients are exploring these different modalities. So my job, I feel like, is to listen to the patient, understand where they're coming from, and help them kind of integrate the two in a way that takes into keeping them at the center. but also respects what conventional medicine has to offer, because there are a lot of good things that chemotherapy can achieve, especially when your tumor burden is high, you have rare cancers, any of those things. So, or if you have hormone positive breast cancer and people don't want to take the hormone blocking therapies, but that is the one thing that will keep the cancer from coming back. It's a very high percentage. So how do we talk to them? So that is where integrative oncology comes in. And if it comes in from within the system that the patients are already in, that has access to dietitians, to physical therapy, to psychiatry, social work, navigation, all of those different things, then it becomes a one-stop shop, at least to start the process, right? So that is where Fred Hutch Cancer Center is quite, it's a cancer destination center, and then this kind of adds an additional layer of support that the patients need to do it safely, first of all.
I love that so much. And, support groups can be very important in cancer. And locally, we have Ann's Place, and I benefited from Ann's Place. And when you're talking with other people who have gone through what you've gone through, that can be very helpful. Now, of course, their patients too, and like you're saying, have tried all different kinds of things. So it's nice to have people with a professional background to run those ideas off of, so you're not trying everything that all the other people tried. So to
Correct.
have a place that's safe to do that, I think that's so important. And then also what so many cancer patients say is, especially like if you have radiation, right? You go every day for a month. I had to do it twice. And then when you're done, like you're used to somebody checking, you feel like they're checking on you and keeping you safe. And then all of a sudden it's like, okay, you're done. But you're like, well, who's keeping me safe? Or you might have more
Yeah.
questions. You're like, what's next? So to have a cancer center support like that, that is so important. And then, Ava, of course, some cancer patients may have either gained or lost weight depending on what their treatment was. So to have also be able to be referred to a dietitian, I think is really important too. So as we're winding down, Ava, just maybe share what you want people to know about your practice.
I would say, well, we're physically located in Connecticut, but we do see clients via telehealth as well. That first of all, not to be fearful, to understand that if you come to us, it's a type of space where we want to listen to our clients. We let you tell, or take the time to listen to your story. We want to work with you. We're not trying to butt heads. We're not trying to tell you what to do. I can't tell you how many clients walk away and say, gosh, I was so nervous coming in because I thought you were going to make me cut out so many things that I enjoy. That's not what the goal is. The goal is to work with you wherever you are in your stage of your growth and your behavior change, to make the most of our time together, to, even if we move you one step, right? I have some clients where we make one little small tweak, and then sometimes a year or two later, they'll come back and say, okay, I'm ready for the next step. So just know that we're there to support you. We're there to work with you. We will communicate with your other healthcare providers if A, we feel it's necessary, or B, you make that request of us. And just use us as a resource. I say that to every client. Use me as a resource. If I don't know the answer, or if I don't feel I can find the answer, I'll point you in the right direction. I'll suggest practitioners I've worked with in the past who I think are good listeners, or who will work with you on this issue. And we're here to support.
I love that so much. And also, I know some patients can feel some shame or embarrassment in coming, right? Because a lot of them are overweight and to talk about these things. But, I have to say, you're just so kind and you really do just want to help, so that people shouldn't let any like shame or embarrassment stop them from coming, because you just want to help and you really can help. So I'm putting a plug in, for that.
Thank you. Say particularly around things like weight stigma too. We don't even have
Absolutely.
a scale in the office. I don't even go down that road, because I want people to look at the bigger issues in their lives. And once we work through those things, the scale will do its thing. right? That's not where my focus is.
Right. And you mean that and you do it. So thank you for the valuable work that both of you offer. And also doctors. Doctors are patients too, right? And doctors come in all shapes and sizes. Doctors sometimes don't have time to eat properly, and often they could benefit from an appointment with a dietitian as well to figure, okay, in my busy schedule, what can I actually do? Or with my shift work or with my stress. So just to spotlight that, doctors you too. And then also, it's interesting because then they know what an appointment with a dietitian is like. And that's why some of mine, even though I wouldn't have chosen to have everything happen to me, I remember I was particularly interested at one point. I was referred to a neurologist, well, nephrologist too, but I was like, oh, this will be interesting because as a physical therapist, like I had never had an appointment with a neurologist. So getting to see firsthand, even though you wouldn't choose it, like what the different specialty, it just gives you an extra appreciation. And then I think you're even more likely to refer patients when you see how it benefits you. And I will put your website in the show notes, and you can send me any other links that you would like me to include. And Madhavi, did you have any final words that you'd like to add?
I do.
My
We've
feet.
talked enough about patients. I just want to tell doctors and other healthcare providers, whoever they may be, that if you can, try your best to work from a place of curiosity and kindness and acknowledge your own feelings and experiences. And from there, don't belittle yourself. Don't kind of say, somebody has it worse than me, because if you don't acknowledge what's going through you and to you, then it's very hard to continue to do the work that we do. So it would be, I mean, that's my sincerest request to everyone. Be kind to yourself. Um, yeah. And I can give you my email that people can get in touch with me through, and my phone number that they can text me on, and I can send that to you via email.
Okay, that's terrific. And I think it's so important for them to hear that from other people as well, right? To be kind for yourself, have self-compassion. That's so important. So thank you
Yeah.
for spotlighting that.
And it's worth the time and investment that we put into ourselves. So do
Yeah, 100%. So, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.
it. Thank you for having
Thank
us.
you, Kim.
You're welcome.